Hello everyone! This presentation is about pressure garment therapy for hypertrophic scar at upper extremity. Who is excited to learn about the pressure garment therapy? You? Well, great! Let's go through it one by one. This is the content of the video. Now, let's talk a little bit about the description. Hypertrophic scar is known to be an area of scar tissue that enlarges above the surrounding skin and presents clinically as red, raised, and rigid. How did this happen? It happened when there is an imbalance between the rate of collagen synthesis and the rate of its degradation that causes a cumulative buildup of collagen that can thicken the scars. What can be the treatment to reduce this problem? Pressure garment therapy can be one of the methods or treatments in treating hypertrophic scar. The pressure that is given on the scar causes it to blanch and reduce the blood flow within the scar. Reduce in blood flow can reduce the oxygen in the scars. When there is a lack of oxygen in the scars, the fibroblasts are unable to produce much collagen, which leads to reduced in scars formation. The purpose of this intervention is to optimize scar control after the surgery, to reduce the scar visibility and scar thickness, to promote hypertrophic scar maturation, to restore the scar formation, to increase scar elasticity, to prevent formation of contractures and increase joint mobility, to reduce pruritus, minimize itchiness and pain, and to improve scar appearance and the look of the injured skin. For procedure, the pressure garment therapy can be given when the client is at the rehabilitation phase after the injury. The general recommendation of the pressure levels should be maintained between 20 to 30 mmHg, but the ideal pressure is at 25 mmHg. To start measuring the pressure garment, the client's arms need to be relaxed at the sides in a neutral position, just like in a picture. Equipment that is needed to measure the pressure garment is measuring tape, pen or marker pen, and paper. There are two methods in measuring pressure garment for upper extremity. For method 1, like in the picture, put a mark on the affected arm by using a marker from where the sleeve will begin to where it will end. Place the measuring tape vertically against the outside of the arm and mark at every 1.5 inches. Then, place the measuring tape softly on the surface of the skin. Wrap the measuring tape around the top of the arm and snug the tape under the axilla to measure each circumference of the arm. Adjust the tape and record the measurement. For sleeve over the elbow, mark the location of the elbow by writing an E next to the circumference closest to the elbow. Let's move on to the wearing regime of the pressure garment. The client needs to wear the pressure garment until the scar is already inactive or mature, which usually takes about 12 to 18 months. Educate the client to wear the pressure garment 7 days per week for 23 to 24 hours per day. Pressure garment can be removed 2 to 3 times per day for 30 minutes. And the therapist can provide 2 pressure garments for the client, which one can be used when the other one is being washed. There are a few precautions that the therapist needs to follow. The first one is to educate the client to only wash the pressure garment in cool water or use mild detergent and do not dry it under sunlight. Check the pressure garment every 6 weeks to see how the client is coping with the garment. If there are any allergic reactions, stop wearing it immediately. Grading is not applicable for pressure garment, but do adjustment when the pressure garment get too loose or too tight for the client to wear. There are a few evidence-based regarding this intervention. From Atiyah et al. 2013 stated that pressure garment therapy is the standard first-line therapy for hypertrophic burn scars due to its non-invasive characteristics. In other articles, it stated that pressure garment therapy works best in reducing scar formation, improved scar appearance, and so on. And although the efficacy of the treatment has never been scientifically proven, pressure garment therapy is still widely used. According to Donovan et al. 2016, stated that pressure garment therapy appears to enhance the scar maturation process if worn between 20 to 23 hours per day. This treatment also can inhibit the development of hypertrophic scar. In conclusion, pressure garment therapy is proven to be effective in treating and reducing hypertrophic scars. By following the correct procedure that involves the correct method to measure the pressure garments, correct wearing regime of the pressure garments, and precautions of what can and cannot do while wearing the pressure garments, the client can achieve acceptable visibility and appearance of the scars, and other complications can be avoided. I hope you enjoyed the video. Thank you for listening.